Okay. So we've got two major trainings coming up that we're very excited about. The first one is advocacy training with Carter Bundy. Um, Not only will we hear from advocates and lobbyists and really understanding the difference between the two and knowing the boundaries between the two, but we also believe we will have legal counsel there, not to necessarily counsel us, but to help guide us through that and discuss some of the changes that have happened federally around that. So that will be very useful. The link is in the chat for that if you would like more information as well as to register. And then also we will be having a training the following week on November 14th, and that will be for fundraising and federal grants. Also, the link is in the chat for that too. The training for fundraising and federal grants will also cover some of the changes that have taken place in 2025 so that you can be prepared for that. If you've never written for a federal grant before, this will be a good primer to get started. If you have, this will be a good refresher, especially with the changes that have happened in 2025. So we invite you to both of those opportunities. They're going to be great. And we also have an event coming up on October 8th, the nonprofit call to action. We invite nonprofit leaders and partners to convene for a sector-wide discussion to provide input on how the state could use some of its reserve funds to ensure community members continue to be served in the face of federal changes. Your insight and experiences are crucial, and your input will be aggregated and presented to the New Mexico Federal Funding Stabilization Subcommittee during October 20th and 22nd meeting. So just so you're aware of that, this is an inroad to speak to that process. Your voice is needed. Sisfora from New Mexico Thrives and our fearless leader, Valerie Alacon, will be leading that discussion. You can scan the QR code for registration for that, but also the registration link is in the chat. So hope we can see you there as well. So a lot of great things happening throughout October and November. All right, so that concludes my announcements. Let's get to our amazing presenters today. We have two presenters today from the University of New Mexico. We'll have another presentation following them. But to start with, from the University of New Mexico, we have Cynthia Aquillo. She is a senior community engagement liaison with the University of New Mexico Health Science Center, Southwest Center for Advancing Clinical and AMP Translation Innovation. Through her work, Ms. Killo strives to increase the number of underrepresented populations in health research with a focus on New Mexico populations. Daughter of immigrant parents, Ms. Killo is from Las Cruces, New Mexico, and has a master's degree in psychology and is currently pursuing a PhD in health communications. Also, we have Dr. Alberta Kong, professor of pediatrics, interim vice chair of research, and division chief of adolescent medicine at the University of New Mexico School of Medicine. Before entering academic medicine, she practiced full spectrum pediatrics and community setting, experience that continues to shape her commitment to engaging local providers and patients in research. As a physician scientist, Dr. Kong focuses on integrated community voices into the research process to better address barriers to participation and improve the design, recruitment, and retention strategies of clinical trials. Her ultimate goal is to advance equitable, community-informed care. She currently holds leadership roles in several NIH-funded initiatives, including serving as community engagement co-lead for the Southwest Center for Advancing Clinical and Translational Innovation. Faculty representative for community engagement with the Primary Care Building Research Integration in Diverse Geographic Environments Initiative, and senior faculty with the UNM Pediatric Clinical Trials Center. Across all of these efforts, Dr. Kong is dedicated to improving health outcomes for underserved populations. We're grateful to have both of you here today, and we will hand it off to you.
Thank you, Joseph. And Berta, Joseph, I believe, is going to advance the slides for us. So whenever you want next, just say next, and Joseph will help us. So thank you, Joseph, for that really great introduction for both of us. Again, hi, everyone. My name is Cynthia, and I just started a new role actually here at UNM with our grant that was just awarded. I've been in community engagement for over 6 years now, and they're entrusting me with more community engagement, so I am now a senior program manager for our community engagement program. And I'll hand it over to you, Berta.
Well, hello, everybody. Good afternoon. I think all my titles were mentioned, so I won't go through that again. But I'm an adolescent medicine doc, and I've been a pediatrician actually out in the community, covered from the newborn nurseries to the school-based health centers and even to private practice. And then I came into academia. And it was during the time that I was actually in practice that I got involved with the practice-based research network. It was actually here in New Mexico. And if you've been here as long as I have, it was called Rio's Net. For those of you who may have been involved with that initiative way back, my goodness, over 20 years ago, I'm embarrassed to say. But it was really through that I became interested more in research. And I continue to focus really making sure the voices of our communities are part of that research process, because the more we listen, the better we can serve our community. And so today I co-lead the community engagement efforts of the two initiatives that you heard, which was the Southwest Center for Advancing Clinical and Translational Innovation. It's short for Southwest CAPTI. And that's actually an initiative that we partner with the University of Arizona. So we're really trying to serve the Southwest. And then PC Bridge Initiative, which is the one I'll be speaking on today. And that works to bring the research into primary care settings across different types of communities. And I'm grateful to be working alongside Cynthia. I think you've met her. I'm actually newer to the Clinical and Translational Science Center. So it's my first time meeting everybody now. But I'm really excited to be continuing this work. Okay, next. And if I'm winded, it is because I really did just drive over here from a community clinic and then ran over here. So I am a bit winded. I'm like, I need more exercise. Okay, the next slide, please. Oh, sorry. Oh, I'm sorry. I missed several slides. I'm looking at, go back a few slides. Oh, and then the next slide is, oh, go ahead. One more. No. Okay, go forward. Sorry about that. One more. Okay, there we go. All right, so I've got a question for everybody. I'm just curious. So if your local clinic could magically add one new service tomorrow, what would you pick? And go ahead and type that into the chat. And I will announce it as I see them. Nutrition consultations. Yeah, I agree. We have a healthy and fit children's clinic here, and you know, I'm embarrassed to say that we can't get that for our clinic either. So it really is a challenge. Home health and hospice. Oh yes, yeah, I've actually had experience with that. Yeah, with my own mother recently. So you're right. Learned a lot of that. You know, really seeing more of the adult care. Endometriosis, diagnosis, and treatment. All right, so some need for OB/GYNs. it sounds like. Anything else? Yeah, nutrition-focused diabetes. And it's great for us to hear because, this is important for us to know too. And we're going to capture all of this also so that we can bring it back to our clinical and translational science center because, we may be able to match some of these things up with the faculty that's doing some of this work. Women's clinic. Yep, I hear that. It's it's a challenge making appointments, even here in Albuquerque, even for me. Really, any specialized services, that's extremely lacking in rural areas. Yeah, I hear that. Really a long ways to drive if you need any specialized services sometimes. And, it's a big challenge. Our state is so large and having to drive to Albuquerque sometimes for that care is a real challenge.
So Joyce Runyon and Shay Yantis, you were the first two to respond to our question. So we are giving you a gift card. If you will private message me on the chat and give me the email that you would like me to send your gift card to, you
I'm
are our
laughing.
winners.
Sorry, I'm laughing at all the emoji signs going up. Yeah, surprise.
Isn't that fun? I know. So Shay and Joyce, make sure I have the email that you want me to send that to.
Yeah, and way to go to be the first. All right. And we can go on to the next slide. Okay. I did have some I want to just mention some other physicians that really lead the study. I don't see the slide here for that, but it is Dr. Andrew Sussman. So if you hear these names, they are what we call the principal investigators of the grant, and there are 4 of them. Dr. Sussman is a professor. He is in the Department of Community Medicine, and he's also in the Cancer Center too, involved with community engagement. And then Dr. Nancy Pondy, she's a medical doctor in family community medicine. She's a professor and also associate department chair for the Department of Pediatrics, and also our director for the Clinical and Translational Science Center, which is now called Southwest Cacti. And then Dr. Hangame Racy, who is a PharmD, so lots of multi-specialties, which is really nice. She's actually in my department, in the Department of Pediatrics. She's also a professor, and she is the vice president for research for our whole UNM Health Sciences Center. And then we have Karen Lutrick, and she's an associate professor. She's actually from the University of Arizona. She's the vice chair of research for the Family and Community Medicine Department. And University of Arizona happens to be my alma mater. So you can see I love the Southwest. I did not go far. So I wanted to tell you a little bit about how this initiative came about. But first, I have a quick question just to see if anyone noticed. What does PC in PC Bridge stand for? Anybody know? Did anyone notice? PC in PC Bridge. Oh, yes, primary care. Nice job. And that is from Margaret Chavez.
Good job, Margaret. So again, Margaret, if you will send me the email that you would like me to send a digital gift card to, you also get a gift card today.
All right, I think people are catching on now. All right, so let me share a little bit of the background about PC Bridge, how it got started. So in June of 2024, the NIH launched an initiative called Care for Health. And the goal is simple, but it's pretty powerful. It's to improve healthcare outcomes across the US by bringing clinical research directly into primary care, especially in rural and underserved communities. And the idea is to make research more accessible, focus on real life health issues that communities face every day, and make sure the results from research actually get used in the care of people that we take care of. And that's where PC Bridge comes in. So it's one of the ways that we in New Mexico at UNM is trying to help turn that vision of NIH into actual action. And let's see, for the program goals, I think there should have been a slide. Let's go back one. Go back one. Yeah, care for health goals. So UNM was added as a hub in January of 2025. And there are other hubs, Oregon Health Science University, the University of Wisconsin, West Virginia University, University of Alabama, and the University of Oklahoma Health Sciences Center. And as I mentioned earlier, the main goal is to bring clinical research into rural and primary care settings. Especially, we want to focus on chronic and common conditions that we see every day. But this program also aims to build strong long-term relationships with communities that have not been included in research before, so that we can actually provide care and better, do that more effectively and also more inclusively. Okay, so the next slide. And then to support this, we're building a research network based in primary care, so right where the patients are. The program will use technology and data sharing tools to make research easier on providers and reduce the burden on clinics when participating in research. And we're going to focus on sustained engagement with underrepresented communities, and then also help apply research findings directly into the care for our patients so that we can improve health outcomes. All right. So here is everybody ready? I was just curious if there are going to be even any answers, but here's a question. What is PC Bridge designed to do?
And if you even want to take yourself off mute to talk, we love when people do that too. So if you would like to do that.
Cynthia would just have to look really fast across everybody. Yes, feel free to chime in because it may take a sentence or more than one word. Joyce? Oh, she doesn't want to be first again. Okay, see how nice and thoughtful that is. Just giving some other people a chance to be first. Because of course, you guys know what's coming after the first answer.
This is Sarah Bowman. I'll go ahead and chime in, but I don't need a gift card or anything. My assumption would be, because it's a bridge, it would be connecting patients to primary care services and helping them to navigate those services more effectively. That would be my guess.
That's a great guess. And it is to connect the rural communities and clinics to the research opportunities. So correct, like bridge, love that. Yay, she understood bridge. We were never sure if people ever catch on that, but wow, that was lovely. That connect word is key. Thank you for sharing that. All right. And then the next slide.
And Berta, Joyce put in chat, connecting rural areas with clinical research opportunities.
Yes, that's exactly it. I just love that people got the bridge part. for the connection. All right. So Cynthia, do you want to?
Yeah, so next question, and get your typing fingers ready. If you could describe your community's health in one word, and this could be positive or negative, what would it be? And go. Or again, if you'd like to come off mute and share what you're thinking also. We love when people chime in.
Unmaintained, limited, underserved, lacking since we lost our clinics. I'm sorry to hear that.
Yeah, me too.
Connected,
So keep them coming. But let's see. Shelly Simpson, you're my next winner since Sarah and Joyce have already answered. So Shelly, if you'll send me an email address that you would like a gift card, we will send that to you.
resourceful. Yes, I love all those. Unmaintained. What do you mean by that, Sarah? Do you mind sharing?
I apologize. The connection cut out. What did you ask?
Oh, I was curious when you put unmaintained.
Well, yeah, because it's complex. I feel like they're not able to properly maintain their health for a number of different reasons, like not good affordable access to fresh fruits and vegetables, or primary care doctors or specialists. For a mental health referral currently, it takes over 8 months to get into our local clinic. And most people have to travel out of state for specialist care. So it's hard to maintain your health if you can't get it done locally and if you can't travel. So there's many different factors.
Well, thank you for sharing that. Yeah, 8 months. That is actually not so good to hear.
Yeah. Thank you for sharing, Sarah. So next slide, please, Joseph. All right, so PC Bridge plans for partnerships. So one of our really big goals for PC Bridge is to develop these partnerships, relationships, and build sustainable collaboration relationships with promoting transparency and shared learning with communities, with clinics. So what we've been doing is clinic engagement through what we are titling Lunch and Learn sessions. And my colleague, Randy Benally, who's actually here with us today, also has been helping with these. But what we've done is we've reached out to different clinics around the state, talking to them about, if we were to get a study, a clinical trial or a health research study, and want to actually start it, implement it in their clinic, what would that look like and what resources would they need? Through these lunch and learn sessions, we've had great dialogue with doctors, nurses, clinic staff to talk about like the physical space that they have to do these studies if this was like a possibility, or what are resources that are lacking? What kinds of things do they need to know? Do they need more training? How much research do they know? Some people are like, well, I learned about research in my undergraduate, but haven't really done much since then. So these were the kinds of things that we were gauging, that we were wanting to know. Next slide, please.
Well, as you heard earlier, we're focused on building real lasting partnerships and not just dropping in to do research. So that means really building trust and working together with the clinics and the communities, making sure the research is aligned with regular patient care, and so it actually helps to improve outcomes. And we want to tap into existing national research networks so that we can share the knowledge that we learn from them, you know, into New Mexico and avoid duplicating efforts. And then most importantly, we want to listen to patients and providers to identify what health issues matter most to our communities in New Mexico. But I think it's a great opportunity for us to have a voice in New Mexico in this national network. Next slide. Yeah. So long term, we want to make sure that the research feels like it's part of routine care, not extra burden. We understand that it's really extremely busy in the clinical practices. And we keep engaging with communities regularly to address new health concerns as they come up, because we know it's a fluid thing. And so we don't want to just touch base once, but we really want to sustain it for a long time. And then when results come out, we want to share them also. We want to share them back with the community, and we want to make sure that they're clear and that they're easy to understand. So we'll need input, you know, for formats. Maybe visuals will be easier. Maybe a short video will be maybe better than, you know, a lot of reading and text. Sometimes we get those very long handouts that may be just difficult to interpret. And so we want to do this not just for the patients, but also the providers. We want everyone to really benefit. Next slide. All right, another question. Who benefits from PC Bridge research? Who benefits from PC Bridge research? Community members. The community research win-win. Everyone benefits, everyone. Yep, that's all correct. So Cynthia, did you capture?
Yeah, so Joanne Lopez is our winner from Roswell Job Corps. So Joanne, send me your email and I'll send you a gift card to that email.
Hi, Joanne. I just came from Albuquerque Job Corps. This is where I ran to. With yeah, I will have to touch base sometimes, because yes, definite challenges. I think I understand. Oh, that's awesome. See, I'm, like I said, really in the community. All right. So and just answer these, because we like to really know, like, is there a clinic in your community that would be a good partner for PC Bridge? We'd love to hear that if you have a clinic in your area that you think, you know, would be great to partner with.
And some of the clinics that we've already did these lunch and learn sessions where we had a lunch with these clinics included Taos, Espanola, Las Cruces, Deming. So if you're from outside of these parts and you're thinking there, oh my gosh, this would be such a cool opportunity for a clinic in my area of the state, let us know. The more, the better. As you know, like always, like clinic staff are always understaffed, and so the more clinics we can get this information from, whenever there are studies that come through, we can do like, okay, we have 5 patients that were part of the study from this clinic and another 5 from this clinic, so we don't overburden these clinics and still be able to get information and data and get people healthy. Yes, Joyce, that would be amazing. If you could send us some clinic names from Tucumcari, that would be really great, and then we can reach out to them.
And Shay had his hand raised.
Yeah.
Who had their hand raised?
Somebody.
That was me, Shay Yantis, Catron County. So we did just lose both of our Presbyterian Medical Services clinics for the county. However, we do have a new clinic that is just starting up and trying to get their feet on the ground right now, and it's the Catron County Cowboy Clinic. And it's privately ran. The main person running it actually comes up from Las Cruces, but I think they would be amazing.
Thank you, Shay. Yeah, that'd be great. And then Sarah's adding some things as well. So I see in Eddy County, Artesia General Hospital, and then Memorial. Yes, that's really great. Let me take a copy of that too. Thank you, Sarah.
Well, thank you for sharing those clinics. And I am going to hand the next slide over to Cynthia, who has done these many with our community, the community engagement studios with some of our communities.
Yes, all right. So community engagement studios are a chance for researchers and community members to be able to sit down and talk together. This model was really put into our literature, into evidence-based practice by Vanderbilt University. So we learned and got trained from them on how to do these. The idea is really simple. Researchers bring questions about their project, and community members share their thoughts, concerns, and ideas. And to be clear, community engagement studios are not considered research. We see them as a conversation. And we usually hold these like during a meal time, so either lunch or dinner, and we provide like a meal for people. We would provide incentives as a thank you for their time. But it's really so that we can have this comfortable space to talk about these questions, sometimes they're challenges that researchers may be having. There's different disease states that are discussed, but we always are trying to ensure that these conversations are done in a respectful, relevant, culturally sensitive way. And so I'm actually going to invite one of my good friends from a health council, Joyce Runyon, to talk about a studio that we were able to collaborate on in Quay County.
Well, thank you for having me speak a little bit. We did this probably 2 years ago, and I was only aware of it because Cynthia attends our health council meetings and she knew kind of what we were up to. We were looking at mental health as an issue, and as we are all finding out, mental health is a huge issue with lots of different compartments and segments in it. So we kind of wanted to narrow that and focus it down, and they helped us develop some questions about what we should ask. I guess we were the researchers. I never thought of us in that capacity, but then we found our target audience, who we wanted to be there, and so they were all there were mental health providers, there were people in the schools, they were people that were working with other adults in our community to help them in different ways. So we had people from faith, schools, youth services, mental health providers, even a regular health provider. And so they came and they provided a meal. All that was bought locally, which always helps your local economy. They made it really, really easy to work together to find this information. And so we kind of had it boiled down to anxiety as being a really important topic that our community wanted to discuss. Thought it was necessary to know what anxiety is good, what anxiety is bad, and there was a lot of misconceptions about that. And then they helped us kind of debrief afterwards. After the session, it was recorded, and we were able to assimilate everything that was integral in that conversation. Developed an infograph, which was really kind of different and exciting. Hadn't done that before. And so there were a lot of things that came about because of that. And it was a partnership with them. And we weren't on our own doing that. It was really, like I say, very easy, really comfortable. And they were just amazing to come in and help us fine tune our mental health issue, what we wanted to look at, what we needed to address. So I highly recommend going through this process if you're able to, if there's something you are looking for as a health council, an issue that you have that you want to dive deeper into. Cynthia, did I forget anything?
No, that was great, Joyce. Thank you. And I'm going to put in the chat, so we were able to publish a paper together also. So if you want to read more about the studio model, about the one that we specifically did in Quay County, there's even a picture that we were able to submit to the journal on the infographic that Joyce talked about. And Joyce was the one who really like designed it, like graphic designed it. And I remember this back and forth of talking about what should go on the infographic and making these concepts that were discussed fit on a one pager so that we could share this with community members, and just having that experience of doing that back and forth together. So take a look at the journal article if you're interested in that, and then you can also see the beautiful infographic that Joyce was able to design. Next slide, please. Oh, I think we missed one. But we actually do have a studio opportunity for all of you. And so I'm going to invite my colleague, Rachel Taylor. There you go. Thank you, Joseph. To talk about that studio and how to become a part of that if you're interested.
So, hello, everyone. My name is Rachel. I work with the community engagement team at UNM, along with Cynthia and Randy, who are here today. Thanks so much for the opportunity to talk about our upcoming studio with PC Bridge. I shared a link to the flyer with some details in the chat if you'd like to follow along or take a look at it later or pass it along. So for this studio, we would like to meet with a group of approximately 8 health council members throughout the state to participate in a 2-hour conversation over Zoom about building trust, strengthening partnerships, and ensuring community voices are heard. We're keeping this group small so that we can make sure that we hear from everyone who is participating. We will be meeting on an agreed upon date at the end of October. Another thing to mention, we will provide an $80 merchandise card for your participation. So on that note, I'm going to share a link to a survey that we'd like for you to fill out if you're interested. And I'll also include my email address if you have any questions in the meantime. And thank you. I hope to see some of you soon. Yeah, I'll be facilitating it. So I appreciate you letting me tell you about the studio today. Thank you.
And also, if you have a colleague that you think would be great from your health council that you would like to share this information but wasn't able to make it today, please share this information with them as well. And then, as I mentioned before, if we had done this in person, we would have had food, but because we can't do that, we upped the incentive. So that's why it's an $80 merchandise card. So if you want to use that to get yourself a meal, you're more than welcome to, but it's your incentive, so you can do whatever you would like with it. But please help us get the word out to other health council members. But remember, there's also very limited space. We're first 8 is what we're hoping for. All right, last slide, please. Does anyone have any questions for either Dr. Kong or myself or Rachel? And then I think the very last slide just had my contact information. Again, if any questions come up about our program, about the studio, please reach out to me. I pride myself on being responsive, so please do so. And thank you. Oh, Eugenia, I see your hand up.
Yes. This is for Rachel. How long is it's not a focus group, but I know the session. How long is that so I can forward that information to somebody else?
Sure. Yeah, thank you for your question. So it's a total of 2 hours. That includes introductions and then some dedicated time for me to ask questions and to allow everyone to speak. And then we wrap up at the end. So we won't keep you over 2 hours. And if if you can't make the entire thing, just reach out to me and we can talk about it as well. But we are going to try to find a time that works for everyone.
Thank you.
I think that's all on our side. Berta, do you have any last things you wanted to say? If not, I think we're good for our next presenter.
Well, just, yeah, thank you everybody for your time. I know, we really appreciate you taking the time out to let us present to you. And Joanne, I will be emailing you. Is that a dot after Lopez, by the way? I'll ask Job Corps, they probably will know. But it was nice being able to connect to everybody here.
And thank you so much for that wonderful presentation and the wonderful work that you guys are doing. We really appreciate that, and just appreciate you and all the good work you're doing. Next, our presentation is, hold on, from Dr. Laura Mago. She brings more than 25 years of experience in global and public health experience to her role as program manager of the New Mexico Department of Health's Comprehensive Cancer Control Program. With her longstanding commitment to health equity and reducing preventable mortality, she has worked as a lecturer at the University of Ghana School of Public Health, as a senior technical advisor or team lead for the United States Agency for International Development, USAID, in Washington, D.C., Nigeria, and the Democratic Republic of the Congo, and as a full-time employee or short-term consultant for more than a dozen NGOs and multilateral agencies, the UN Refugee Agency and the WHO. Through her postdoctoral fellowship in STDs at Johns Hopkins University, she had a rotation at the CDC's National Center for HIV and STDs. Laura moved to Albuquerque in 2021 and enjoys the outdoors. Awesome. And walking her dog. Beautiful. Welcome, welcome, Dr. Mago. I'll hand it off to you.
Thank you. Thank you to our colleagues at UNM for that wonderful presentation and helping set the stage for some of the issues about community engagement. And I want to actually introduce my colleague, Dr. Tara Golden. I apologize for not sending a bio about her as well. She's going to start the presentation. And Dr. Tara Golden finished her preventive medicine residency at UNM and got her MPH there. Tara, could you just give a few words about yourself? And then we'll go ahead and launch. I know you're going to be sharing the presentation.
Sure. Thank you so much. And thank you to everyone for this opportunity to present. So I'm Tara Golden. I am the health educator with the New Mexico Department of Health's Comprehensive Cancer Program. As Laura just said, I did finish my preventive medicine residency at UNM and got my MPH while I was there, and I got really interested in public health and population health. So I'm really enjoying my non-clinical position here with the Department of Health. Bear with me for one moment when I'm going to get this PowerPoint shared.
And just to let you know, we're going to divide the presentation. So Tara will start. There you go.
Let's see, it's thinking. One moment. Does it look okay on everyone's end?
It's perfect.
Wonderful. Thank you.
It's in slideshow now. Thanks.
Great. All right, so I'll present first and then I'll pass it over to Laura. So the New Mexico Department of Health Comprehensive Cancer Control Program's purpose is to reduce the cancer burden on all New Mexicans through promoting prevention, screening and early detection, access to critical services, and collaboration among public and private organizations, departments, and agencies. And our program provides support to a variety of organizations that provide services. And we also provide support to the New Mexico Cancer Council, which we'll talk about a little bit more in a moment. So just to dive in a little bit more into our areas of focus. So prevention is definitely one of them. And of course, this means promoting healthy habits and the environments that enable people to make healthy choices. Obviously, this is very important in the cancer realm because it can help reduce risk factors and has the potential to prevent cancer from happening. And another big area of focus that our program has is screening and early detection. And this can help identify cancer when there are no symptoms yet in its early stages, when it's easier to treat. And then, for instance, in colorectal cancer, screening can also prevent cancer because abnormal growths called polyps can be removed through colonoscopies. Other areas of focus for our program include survivorship. That really focuses on the well-being of people diagnosed with cancer. And then a last area of focus that's important to us is collaboration. Collaboration makes for more efficient use of resources and enables greater impact. There's a few different ways in which we collaborate within our program's kind of domain. So for one thing, we do have a number of contractors that work on some of the other areas I already mentioned, that so we collaborate with them. We also really try to collaborate with other programs within the Department of Health. And then we help coordinate the New Mexico Cancer Council, and that's a public-private partnership that works to reduce the burden of cancer in our state. And different organizations or individual members can join, and really it provides a network not only for sharing of ideas and potential collaborations, but also offers opportunities for work groups which work on different activities. And then we'll talk about it more in a little bit, but the Cancer Council also comes up with the New Mexico Cancer Plan. So cancer is uncontrolled abnormal cell growth and division in an area of the body that can spread to other areas of the body. And there are more than 100 types of cancer. The American Cancer Society estimates that there will be 11,500 new cases of cancer and 3,900 deaths from cancer in New Mexico this year. And cancer is the second leading cause of death in New Mexico and the United States. So this means a lot of people's lives in our state end up being touched by cancer. So right here, this is a bar chart of just certain selected cancers, the incidence rates. That means the rates of new cases of cancer in our state for women. As you can see, for women, some of the more common types of cancer include breast cancer, lung and bronchus, and colon and rectum. And there are differences in the rate of new cases by race and ethnicity. Okay, so now this is a bar chart showing the incidence rates for men in New Mexico. And some of the more common cancers include prostate cancer, lung and bronchus, and colon and rectum. And as you can see, there's also differences by race and ethnicity when it comes to the incidence rates for these cancers. All right, so for 5-year cancer survival in the US, the average is 69%. But if we look at kind of what that 5-year survival is for different states, actually New Mexico ends up being in some of the states that have the poorest survival. Thus, cancer prevention and control is very, very important. And when it comes to cancer prevention, there's numerous ways to lead a healthy lifestyle. Of course, not all cancers can be prevented, but there are numerous steps that can be taken to help reduce the risk. And some of these ways include not using tobacco, limiting or not using alcohol, engaging in physical activity, eating a healthy diet, maintaining a healthy weight, using sun protection and avoiding indoor tanning, and engaging in healthy behaviors to prevent certain infections, including getting vaccinated for hepatitis B and HPV. And then another way is to, of course, have regular checkups with your doctor and get your cancer screening tests done. So when we're thinking of cancer prevention, we really want to think of like the big picture when it comes to like communities and the environment around people. We want to make it easy for people to make these healthy choices. This includes changing the environments and policies to help people make these healthy choices. It might be taxing cigarettes or building walking trails. It's also important to combat the stigma around certain behaviors such as smoking or the stigma around things like obesity. And there are programs in New Mexico to help support healthy behaviors. One I'd like to mention is 1-800-QUIT-NOW. This is the tobacco and nicotine product quit line, and this provides free help quitting all nicotine and vaping products. It's a 24-hour support. It allows people to have a personal quit plan, as well as various self-help materials. People can get nicotine replacement therapy through this, and can also get unlimited sessions with a trained coach. Another area in the prevention realm that I wanted to mention is the increasing recognition of the role of alcohol on cancer risk. So earlier this year, actually, the US Surgeon General released an advisory on alcohol and cancer risk. And alcohol consumption is the third leading preventable cause of cancer in the United States after tobacco and obesity. So we're seeing that alcohol is a risk factor for cancer, and consuming alcohol increases the risk of developing at least 7 types of cancer, as you can see in the graphic on the left. And these include cancer in the oral cavity, the throat, the voice box, the esophagus, breast in women, liver, and colon and rectum. And then if you look at the graph on the right, higher alcohol consumption increases alcohol-related cancer risk in both women and men. And the more that a person drinks, that risk actually goes up for cancer. So these are just a few different resources when it comes to alcohol and other addiction support. The Addiction Center's confidential alcohol hotline is listed there. There's also the 988 number for people that are in crisis around different issues. And then there's also the New Mexico 5 Actions program. As you can see there, there's the website, and this allows people to kind of assess their use of substances and create a road to change along with those, and also allows them access to peer support. Switching gears to another cancer prevention topic, I wanted to talk a little bit about human papillomavirus. So this is HPV. HPV is a very common viral infection that's transmitted sexually that can cause cancer later in life. Most HPV infections go away on their own within 2 years, but sometimes HPV infection will last longer and can cause cancer. And in fact, HPV can cause 6 different types of cancer. This includes cervical, oropharyngeal, so that's like cancers of the oral cavity and the throat, penile, vulvar, vaginal, and anal. And the HPV vaccine has the potential to prevent more than 90% of cancers caused by HPV. Research has shown that receiving the HPV vaccine at the recommended age does not increase sexual behavior or cause earlier sexual activity. Primary care providers, New Mexico public health offices, and certain pharmacies can provide vaccinations, including HPV vaccination. And then the New Mexico Department of Health Immunization Program has interactive maps to find vaccination providers for underserved children and adults, and these are available on their website. And then, of course, the New Mexico Department of Health does have a helpline that could also help with this. So now just kind of expanding out to a little bit more on cancer prevention, really looking at, living and working in a healthy environment. So it's important to have safe air quality, for example, no secondhand smoke, radon, nor other cancer-causing substances. Safe water quality, for example, no arsenic nor other cancer-causing substances. It's also important to prevent exposure to anything else that could cause cancer that people encounter in their everyday life. Another aspect is safety rules and regulations in the workplace to prevent or reduce exposure to cancer-causing substances. And then to kind of circle back around, another part of a healthy environment when it comes to cancer prevention is having access to healthy food and spaces for physical activity, as well as, of course, having access to healthcare and health-related resources. So just to kind of put everything in perspective, when it comes to cancer prevention and screening and the importance of that, it was found that from 1975 to 2020, prevention and screening efforts actually helped avert 4.75 million deaths from 5 cancer types, including breast, cervical, colorectal, lung, and prostate.
So Tara, can I interrupt you because there's a question in
Oh,
the
sure. Sorry, I
chat
can't
box?
see it.
And
Thank
yeah,
you.
no, so Joyce says, although the recommended ages to receive the HPV vaccine are for youth, is it also available for older adults?
Honestly, off the top of my head, I'm not sure, so I'd have to look into that because I don't want to misspeak on that. But um, I apologize for not having that answer right at the
Oh,
moment.
sorry. And then, but just the recommendations are up to age 26. And then it can be for those age 27 to 45 if you discuss it with your provider. But you have to discuss it with your provider. So the general kind of rule is up to age 26, and then after that, discuss with your provider. So,
Yes, thank you.
and
Yeah, yeah, definitely discuss with the provider. Thank you. And then another aspect that I did want to present on was the New Mexico Department of Health Breast and Cervical Cancer Early Detection Program. So this is kind of like a sister program to our comprehensive program. And the breast and cervical cancer program provides free breast and cervical cancer screening and diagnostic services through healthcare providers across New Mexico. So those who have little or no health insurance and have a low income may be eligible for the program. And those who are enrolled in the breast and cervical cancer program and then are diagnosed with breast or cervical cancer and need treatment may be able to get a special category of Medicaid. So on this slide, I have included the website for the breast and cervical cancer program at the Department of Health, as well as some contact phone numbers. This can help people find a BCC, which stands for Breast and Cervical Cancer Program Enrollment Provider. So basically can help connect people with a provider that's part of the BCC program. All right, now I'll go ahead and turn it over. Thank you.
thank you, Tara, so much. That was so helpful. I really appreciate it. So I just want to kind of highlight, some of the big takeaways is that in New Mexico, you're less likely to get cancer than if you live in other states. So we have lower incidence, but I think Tara showed the bad news that you're less likely to have a 5-year survival rate. And that we're still trying to understand why those who receive a cancer diagnosis are less likely to survive than in other parts of the country. There is good news that there are more people surviving. There's some studies going on. We know that some things that play a role are the fact that people are often diagnosed later. So they might be diagnosed in a later stage when they have fewer options for treatment. We know that there's a big problem with healthcare access, and that's why we've been working on the New Mexico Cancer Plan. I'll talk about that just in a couple of minutes, but we're really highlighting the impact of the health worker shortage on the cancer burden in New Mexico, and that impacts the primary care as well. So Cynthia, I'm so glad you were here to set the stage with your work on primary care in New Mexico, because that is such a critical part, like those access to that screening services. So the Comprehensive Cancer Program from the Department of Health, as Tara already explained, works on primary prevention, screening and early detection, but also survivor services. More people are now surviving cancer. That is good news. Across the US, 18.6 million people. But and when we talk about cancer survivors, what that typically means, the way we use the word is from the time of diagnosis, that day of diagnosis onward. So it could include people who are now cancer-free. It could be those with advanced cancer, and it can be that very day and day after. And our cancer survivorship programs, we emphasize survivors' health, well-being, and quality of life. making sure that we can address the physical components, which include managing cancer symptoms and treatment side effects, social, emotional, and mental health concerns, as well as promoting healthy behaviors. Next slide, please. And we will include our website has a link to the different survivor services that we support. So you'll get all of this afterwards. So some of the things that really improve survivor and quality of life after diagnosis, and this cannot be emphasized enough, is quit smoking. And so a lot of people think, oh no, I already have cancer, it's too late. And actually, no, the more recent studies really show that quitting smoking is one of the most effective things that you can do. It's very important also making sure that you're, with advice from your doctor and care team, engaging in physical activity and healthy eating. These are also very important. Patient navigators are critical, and many of the major cancer care centers have them. They can help with appointments, follow-up, and referrals. Please join a support group. So there's Department of Health support for Cancer Support Now of New Mexico, but also others. And they do have services. So right now we're supporting cancer survivors in all but 4 counties in this state. And we're totally happy to support all 33 counties. I think sometimes the word hasn't gotten out. So sometimes it can be one-on-one calls with an individual person, try to connect you with someone in a similar situation, as well as referrals to group support. Just a reminder, sorry to miss you, Tony, and yes, I see the messages in the chat. And I can't comment on exactly where all of the support groups are, but if you're trying to find out, connect a cancer survivor, please call this free helpline through Cancer Support Now, and they will do the connections, and they can set up a one-on-one support if there is not a group support, a cancer support group in your particular county or area. Caregivers need the support as well. We cannot forget that. So we'll share this presentation so that you can see some of these links. Next slide, please. So the New Mexico Cancer Support and Treatment Directory, we have physical copies, but I think what might be more useful for you is to just access this online. The online version is updated. We're in the process of updating the entire thing, and it is statewide. So there are references to different support groups or services throughout the state. Next slide. I do want to talk a little bit about the cancer plan, because right now we are in the process of working on updating this cancer plan. So in case some of you might have seen this, the last one did receive a major award for the Native American implementation strategy, but basically all states have a cancer plan, and these plans help kind of catalyze and coordinate efforts to reduce the cancer burden and achieve more through collaboration. It's produced by the New Mexico Cancer Council, which Tara explained is this public-private partnership. We collaborate with them and provide a lot of support, and it's currently being revised. Next slide, please. So what's happening? Basically, the state cancer plans reflect the priorities of each state's cancer coalition. So in this case, it's the New Mexico Cancer Council. Any of you on this call are absolutely free to send me or Tara an email, or both of us, if you would like to provide some inputs to what you think is important. I think one of the shortcomings in the past is we haven't had enough engagement across the state. We haven't had input from health councils. If you'd like to be a reader too, that would be very helpful. We've already had quite a few meetings, but they're not yet finished. Our next meeting is on October 24th, and it's going to be on care and treatment. Then we have survivor issues in November. There should be a draft of the plan ready in early January. And if you want to provide inputs, please reach out to us. And Tara, could you type our email addresses just in the chat so people have that handy? So basically, the state plans vary tremendously, but they do tend to at least cover the main areas of primary prevention, screening and early detection, health and well-being of cancer survivors, and what we might call the social determinants of health, or what are the different disparities and inequities in a state. As I said before, this time we're really focusing on the health worker shortage and its impact on the cancer burden, just because we're hearing too much, too many stories about that. Next slide, please. So we're very proud of the fact that the last New Mexico Cancer Plan had a strong implementation plan in Native American communities. 21 people participated in that. It received a national level award. And there will be an implementation plan for Native American communities this time as well. Next slide. So there's a lot to learn about tribal cancer plans. They are typically need to be tailored to local needs. So here's just an example of another, the Great Plains Tribal Leaders Health Board and their comprehensive cancer control program. And there's some things that really resonate with issues here in New Mexico. Obviously, the education needs to be ongoing, empowering, and tailored for each community. Funding for screening is an issue because not all tests are covered by the Indian Health Services. And the last issue, we really want to emphasize Native cancer survivors often get lost in the system during diagnosis, treatment, and beyond, and have difficulty navigating through the healthcare system. So we also hear this in New Mexico and want to improve. So your suggestions are most welcome. Next slide. The other thing that we're doing this year is including a lot of personal survivor stories. This is a photo from a woman, a cancer survivor in Arizona, and she shared her personal story. We only ask that people share their first name and last initial if they're comfortable, or a photo. They can also choose a landscape. If you know someone who would be interested in sharing their story, it would be really helpful. It's helpful for advocacy, and it's especially helpful for us to get stories of rural cancer survivors and the challenges they face, so that people really understand that. So I would really appreciate if you had that. So some things that we really want to do and are trying to do better this time is including those personal survivor stories. Talking about caregivers and families, that wasn't mentioned in the last plan. We didn't mention childhood, adolescent, and young adult survivors, and considering that the profile of certain cancers is going younger. So, for example, colorectal cancer, we're finding a surge in cases of younger adults being diagnosed. This is even in their 20s and 30s, and this is a big change, so we'll need to highlight that. We're also going to include advocacy goals, such as increasing the state budget for specific cancer programs. And I really want to drive home to you why that's so important. So maybe it could even be part of what health councils are asking for too. So state funds, it's primarily state funds that we use to support the survivor services, and we can use New Mexico state funds to do a variety of things that we cannot do with federal funds. So for example, with state funds, these different survivor support organizations, they can actually pay the cost of lodging if we have to, and transportation. So say you're in Hidalgo County, wherever you are, Key County, and one of your community members needs to travel to Albuquerque, our state funds can go to support that. So it's really important to increase that budget. So if you have any advocacy wishes, I really strongly advise you to do that. Whereas our federal funds for survivorship are at a much higher level. Funds like Project Echo type things training primary care providers in how to treat cancer survivors. And those things are important, but I also know there's just really real world daily concerns like my cancer survivor does not have enough money to get to the treatment center. So it's important. Next slide, please. So I wanted to give a chance for some of you to give feedback. It's really important for us to know from where you sit, from your experience, which issues are really important to you and your community for the next cancer plan. So would these be policy, legislative, and advocacy goals, health workforce issues, the availability and quality of services across the continuum of care for cancer? Would you like to have things like establishing 5-year survival decrease mortality goals? Things like, yes, we want more people to be surviving in New Mexico. A focus on children, adolescents, and young adults, families and caregivers. Do we need to make the public more aware of alcohol use and its relationship to cancer? And also thinking about the mental health of survivors. So we've both, Tara and I would like given you a lot of information here. So I want to pause and give you all a chance to respond. So I'm just going to go on mute for a minute. And wait, and I'm asking for what are the priorities for you based on where you are. And thank you, Sarah Jo Bowman, for jumping in right away. Any others? Margaret, I see your hand up. Go ahead.
Hi, yes. So my name is Margaret Chavez, and I'm the coordinator for the Hidalgo County Health Council. And we, again, like as I was stating, there is a nonprofit charitable Hidalgo County Cancer Hope and Healing that we run. We've been running for going on 2 years now to help those with travel, lodging, whatever that might look like that from their family, because I don't know if you know where Hidalgo County is, but out here in the Boot Heel, we're, like one of the ruralist or the rural areas. So you got to travel, 3 hours east, and then maybe 4 to 5 hours west to get any kind of care. So I would say with Hidalgo County, availability, quality of services across continuum of care, and mental health of survivors. I'm a really strong advocate on mental health. I think that is strong for all of us, whatever that may be, including those that are um, cancer survivors or family of those that are dealing with it with them. We have a mama that is battling cancer here in Hidalgo County, and she has 2 daughters, one still in high school, and the youngest one in high school advocates and every time she advocates on how it is to watch your mama go through what she's going through, it's in tears. So I believe that is, we can't forget those caregivers or those that families that are sitting back and watching them battle and bravely battle those that are um, going through this process.
Thank you so much for sharing that. So I've taken your contact information. I will reach out to you. Unfortunately, I'll have to be next week on Monday and just talk with you. There are currently some resources, for example, for people who have to travel all the way to Albuquerque for treatment. There's a place called Casa Esperanza where people can get free lodging and food for not just themselves, but also their caregivers. But I will call you on Monday to follow up, okay?
Thank you so much. I appreciate you.
Mhm.
Hello, this is Gina Posada, and I work at the Doña Ana Health and Human Services. Being so close to Texas, I live in El Paso, and so I am a cancer survivor. So my story does not relate to a rural community. I'm not a constituent here, but I do work on a volunteer basis with American Cancer Society Cancer Action Network. And we do advocate in Washington, D.C. I met some people that live in New Mexico. And so it is very important to try to change policy and get funding for early detection research. And so right now, with all the limitations that we're seeing, it is very important maybe that we have some type, I don't know if your directory has already places where people can have, like you mentioned, Casa Esperanza. Another issue too that I might see as a barrier is when you have these diagnoses and you have employment, but at the same time, sometimes because of the chemo, you cannot or do not feel well to make it work. What are the issues facing accommodation or your schedule changing? Are we working, having so many survivors now, thank God? Do we have anything returning to work research type of journals or anything like that that can provide guidance on that as well?
Thank you. Could you explain just the last question? The
Right.
guidance on the.
Well, a lot of people have been diagnosed and some of them have work. And so returning to work after that diagnosis, how are they facing those issues or barriers or challenges in getting some type of accommodation? Accommodation meaning when you have breast cancer and you have a mastectomy and you cannot do certain movements and you have to lift a patient if you're a nurse, or if you're doing accounting and because of chemo, you get chemo fog and you cannot be this, the same usual self of um, retaining the memory that you need for accounting. What are those barriers?
Right. I gotcha.
Right.
Yeah, so could you also send your email, put your email
Sure.
address in this? So because there is a national level organization that works, I mean, unfortunately, the process for getting on Social Security disability can take 6 months, and that could be quite a challenge for people undergoing treatment, and then getting those workplace accommodations. But I can send you the name of an organization that works. So think on the specifically on those issues. So thank you, Gina, for sharing your story. Joyce, I see your question about places besides Albuquerque for treatment care options. Absolutely, there are other places. And again, you can get that from our care and treatment directory. In terms of, there are 5 Commission on Cancer accredited cancer treatment facilities in New Mexico. So one of them is in Las Cruces, and that's Memorial. But there are other ones, and you can still get good quality of care at other ones. So the treatment directory is the kind of comprehensive resource for that. And then sometimes you might want to travel. So the only the UNM is the National Cancer Institute designated facility. That makes it sort of like the kind of the leading cancer treatment center in the state. So sometimes patients might go to UNM and then have follow-up at a cancer care treatment closer to them. So so absolutely. Joyce, was there another question that you had?
Yes, I was really thinking it was important to highlight the alcohol use. I think as a state, we're really high on alcohol use in general and related diseases, but I don't think a lot of people connect cancer with that. We think, oh yeah, these are the regular things that go with alcohol, but cancer is a new issue that's being correlated to that. And so I think that's really important to highlight because we're already at the top for alcohol use anyway.
Thank you for that, Joyce. Yes, and thank you also for the appointment that not everybody's on treatment wants to be on leave and being able to work if you can. Okay, great. I see these email addresses. Tara, are you able to get them? Because I'm trying to desperately to write.
Sure, I'll try to grab all the.
Okay, and then also if you don't hear from us, please reach out to us just because we're trying to scramble to get all these emails. So that was it from us. So thank you very much for the opportunity to be here. Thank you for allowing us to present. I really appreciate it, and we would love to have more engagement with health councils. Thank you.
And thank you again for that amazing presentation and all that you are doing across the state and working on such an issue that really, it touches everybody. It really does. So we really appreciate that. And thank you to all the health councils and partners that joined us today. And again, you guys are always rocking and rolling and just keeping your communities moving forward. So we appreciate all of you. I wish everyone have an amazing weekend and that somehow, this is just something I'm sending out into the universe. We get an extra Saturday. I don't know who I need to talk to make that happen. If you guys know, let me know, but that's something I'm wishing for everybody today. You guys have an amazing Friday, and our next one will be on October 17th. We'll be happy to see you all there. Bye.